Hi, people. It's time for a talk about bioethics. Ethics, as you might know, is about morals, what we should do rather than what we can do. Bioethics examines these ethical, philosophical issues surrounding biological and medical research, genetic technologies, and treatments. So think about things like informed consent. Who owns your healthcare information? Political consequences and social consequences, who pays for things, all kinds of stuff like that. So, in general, let me just move myself around here. So, in general, societies are responsible for establishing rules, right? We have laws on the books, we have unwritten laws on the books of how we should do things in society, and that includes guidelines for genetic technology. So, for example, is it always doctors know best, or is it patients know best? If doctors need to get informed consent to do a procedure, they're not going to teach you 7 years of medical school. So how informed does someone have to be before it counts as them consenting? So let's watch a high school student explain bioethics.
From several professional scientists what bioethics means to them, but let's hear what the next generation thinks about bioethics. What does bioethics mean to you?
I think bioethics is the different controversies of what scientists can do to your body and what rights then you have to their discoveries. For example, if you're unconscious or in a critical state, what doctors are allowed to do to you without your permission. For example, are they allowed to save you, or are they allowed to put you in life support, maybe if you don't want them to? Example is if you give a scientist maybe a hair or a skin sample, and then, I don't know, in their DNA they make some crazy discovery, then do you have some of the rights to those discoveries because it was made from your DNA sample, or is it all their merit because they're the scientists and they're the ones that made the discovery?
So this then becomes a question of what's most important. Is it the doctor-patient or researcher and subject relationship that should be prioritized? Or is it the good of society as a whole? Some people think that we put in too many roadblocks to doing scientific research, and other people think that we're too permissive, that we're allowing science to hurt people for no good reason. The right answer is tricky. Here's the other problem. You can't unknow things. So if, for example, I get a genetic test for something like Huntington's disease, Huntington's disease is an incurable genetic disorder where your neurology, your nervous system, breaks down. And it kicks in around age 35 to 40. There is no cure, there is no treatment, there is nothing that can be done. You are going to very quickly lose control of your body and die. Now, we have a genetic test for this. It's a very easy genetic test. It's one gene. But if Huntington's disease ran in your family, would you want to know? Because once you know, there's no way to take that information away. The other issue is who has the right to know? So if I get tested and I found out that I have a risk of breast cancer or Huntington's disease or early onset Alzheimer's, who is my doctor allowed to tell? Are they allowed to tell where I work? Are they allowed to tell my parents if I'm an adult? What if I have a sibling who should also get tested? What if I don't want that sibling to know? Whose wishes are more important? My wishes to keep this private, or my sibling's right to know that they should maybe get tested for something? It's tricky. Does my insurance company have a right to know if they're going to have to potentially insure me against this illness? I don't know. It's also worth considering that this is all very expensive. Most genetic disorders are rare. They affect less than 200,000 people in the US, which they have a population of 330 million. So that's not a lot. Gene therapies are expensive. Here's one example of one that is currently working in the US and we're getting it approved in Canada, Luxturna. This treats people who have retinitis pigmentosa, which causes blindness. You basically just lose your vision until it's gone. The gene therapy costs $850,000. Others cost more. In the US, it's estimated that 1,000 people could benefit from this. That is 0.0003% of the population. It's $850,000 per person. And that doesn't include the cost of the hospital stay. That's just the gene therapy. So is that worth it from a cost-benefit analysis? What other healthcare stuff could we buy for $850,000? I don't know. Bioethics. It is a really complicated thing, and we don't know what the right answers are. But the issue is that people are actually making decisions. And so it's important that bioethicists are involved in these decisions to consider all the angles. A recent example would be the COVID-19 vaccine. When we first got the vaccine, there was a very limited amount. Who gets it first? Do you give it to your most vulnerable populations who are likely to die? Or do you give it to your super spreader populations who are more likely to spread the disease? Who gets it first? The committee that had to decide that in Ontario had a bioethicist on the committee to help them make that decision. Bioethics, something worth exploring.